atrial fibrillation, irregular heartbeats. Do we know what causes atrial fibrillation?
Well, it's an incredibly common heart rhythm disorder, and we have an idea of what causes it, but it's very complicated. It's not one thing. It's probably part of the aging process in the majority of individuals. And as your heart gets older, it's more prone to these abnormal rhythms.
Mm-hmm. Just gets old and tired and decides to get kind of punky on you, huh? Is that kind of it?
Well, I think that what happens is as we get older and sometimes the chambers of the heart can enlarge a bit and you get the deposition of some scar tissue and these abnormal rhythms can occur. The good news is that there's a lot that can be done today that we didn't even know about in the not too distant past. So, the good news is that there's a lot of great treatment options, and while this can be a very dangerous rhythm, there are really effective therapies at reducing the risk of stroke and controlling the rhythm itself that most people aren't aware of.
Mm-hmm. Who gets AFib? Is this an equal opportunity situation?
Not really. This is a disease of getting older, and earlier on in life, men are more likely to have it than women, but then women sort of catch up. So we don't see a lot of AFib in 30-year-olds. We see a lot of AFib in 80-year-olds. And unfortunately, there are other risk factors for atrial fibrillation beyond age, and those include things like hypertension and diabetes and coronary disease that also increase in prevalence as we get older. But, there are some things that contribute to it, some lifestyle choices that we make that actually, if controlled, may reduce the chances of you getting atrial fibrillation. So while we can't reverse the aging process, there are things that we can do.
Such as? Is it all kind of living well, diet, exercise, don't smoke, don't drink as much, that kind of stuff?
Yeah, a lot of it is like that, right? I mean, we know that moderate exercise is good for you. Staying slim is important. Reducing or eliminating alcohol is quite important. And then there are other risk factors that you may not think about very much, like treating sleep apnea. Very, very important. It's a very common problem in people with atrial fibrillation, and treating sleep apnea can also make that get better. And then we're also understanding that reducing the stress in your life and getting a good night's sleep may also reduce the risk of you developing atrial fibrillation. So a lot of it, as you pointed out, are sort of the common things that we recommend, but they're important not only for some of these other risk factors, but for specifically the development of AFib.
Mm-hmm. Can I have AFib and not know it?
Yes, and therein lies the problem. Many people with atrial fibrillation report symptoms like palpitations or they get more winded when they exert themselves, but for many patients they may have absolutely no symptoms, and their first symptom may be a stroke. Right? AFib is a major cause of stroke, and the fact is complicated further by the point that AFib may come and go. So you may not feel it, and it may be intermittent. So when you go for your yearly exam and your doctor examines you and says everything's fine, well, that doesn't mean you're out of the woods. And that really leads to this other important point. How do we find a disease that you may not feel and that may be very intermittent in nature but may have devastating consequences like stroke? And this is an interesting time because there's now a whole group of consumer-grade electronics that you could download to your smartphone or attach to your smartphone, or simply buy a smart watch that have algorithms and technology in it to look for atrial fibrillation. So these days, rarely a day goes by where someone doesn't call me up and tells me that their smart watch told them they had atrial fibrillation. Right? No doctor ever touched them.
Wow.
So I think that that's going to be a really important point moving forward.
The miracle of technology has come to the rescue here on this, huh?
Yeah, well, I think we still need to determine whether we should be screening the population for atrial fibrillation, right? You need to figure out whether you're going to be finding a disease early and treating individuals with something like a blood thinner if they're truly at risk, and whether we can prevent bad things from happening. And those studies are just beginning because this technology is relatively new. But I think that if we answer those questions favorably, it's going to change the way we find this disease before something catastrophic occurs.
Mm-hmm. Are there any downsides to this technology? I mean, does it can it be kind of like a kind of like a Chicken Little type thing? Oh, the sky is falling. I have AFib, and no, I don't really have AFib at all. I mean,
yeah,
could
well,
it be kind of like a? Go ahead.
Well, yeah. I think what you're getting is that issue of false positives, right? That the screening test is wrong, and part of this advance in technology is that, like with your smart watches now or your smartphone, you can actually record an EKG. So you're not going to the doctor saying my pulse was irregular, which can have many causes. You're actually going with a 30-second ECG recorded from the device, which your doctor can read. Right now, we're having doctors confirm the diagnosis with sort of medical-grade technology, but you do run that risk that you have false positives, although truthfully, I think the risk is quite low. I think the technology is very effective. I think the other issue is cost. Any new technology, the costs tend to be higher than what it ultimately comes out to be. But I think in the not-too-distant future, you're going to see a lot of technologies on the market that will be able to sense abnormal heart rhythms and maybe other disease processes that can be detected or managed on an individual basis. So I think this is really empowering to the individual and to the patient, which is really important.
Uh-huh. How is AFib treated these days? You say that the research is improving, the technology is improving. Are the medications, are the treatments for AFib improving as well?
Absolutely. And one example I'll give you is that, we've probably all heard of a drug called warfarin or Coumadin, which is the blood thinner, been around since the 1940s, and that's the only drug we had. And in the last, 8 or 9 years, we now have 4 new medications that are essentially replacing Coumadin for the majority of people that are probably better, safer, and easier to take. So that's one example. The other example I'll give you is this area of ablation. Over the last 20 years, we've developed techniques to enter the heart through the blood vessels, find the source of atrial fibrillation, and eliminate or reduce the amount of atrial fibrillation you have. So we have this technique, which is a very effective option for patients who are very bothered by their atrial fibrillation, where medications have either failed to control it or have resulted in intolerable side effects. So not only can we do a lot to prevent stroke from occurring, but we can do a lot to perhaps reduce or eliminate the abnormal rhythm itself with a minimally invasive technique.
Wow. Are there varying levels of AFib? I mean, can there be, like a light AFib, a medium AFib, a heavy AFib?
Well, that's a great question. I mean, it's really interesting because there are people who are in AFib 24/7 for decades and don't feel it, and there are people who have a few minutes of AFib every few months and are tortured by it. So it is a very heterogeneous disease that affects people in very different manners, and even your risk of stroke needs to be estimated on an individual basis. So because it's such a complex disease, it's really one that really deserves a lot of medical attention. And I think for patients who have this disease, to have a conversation with their doctor, and many of these patients are ultimately referred to not only cardiologists, but people like me, called cardiac electrophysiologists, who specialize exclusively on heart rhythm disorders.
Right. I've got about a minute or so left with you here, Doctor. Let's talk about preventing stroke. Can someone with AFib prevent a stroke?
Yeah, so certainly the blood thinners that I mentioned before are very effective at reducing the risk of stroke. For some patients where they cannot take a blood thinner because of the bleed risk, there's a little umbrella that we could place inside the heart, again, through the blood vessels, that can block off the area where the blood clots form. So that device, called a Watchman device, is also an effective strategy. So I think the best thing that we can do for your listeners today is those that have AFib, they need to be evaluated for their stroke risk and either get on their blood thinner or discuss an alternative, because these strokes can be devastating.
Let's get some information out. Where can people find out more?
Sure. Well, if you want to contact us at Northwestern, the website is heart.nm.org. That's NM for northwesternmedicine.org. And the Heart Rhythm Society, which is our professional society, has an excellent website, and that address is hrsonline.org. hrsonline.org, O-R-G. So hrsonline.org.
There we go. Dr. Rod Passman with Northwestern Memorial Hospital, I thank you for a few minutes out. Interesting stuff, and best to you in Chicago.
Thanks for having me.